you for joining us for our Keeping Pace podcast.
Thank you, David.
And please remind me the name of your company.
We're Peer Professionals of California.
Terrific. So Peer Professionals of California. What a great name. And thank you so much for joining us.
Absolutely.
Just kind of like to ask you a few questions, if I might.
Sure.
What brought you to your current employment?
What brought me to my current employment was my role working with Access California in advocacy. During that time, I was working with Access in Sacramento from a lived experience persona. Senate Bill 803 came to life, which was the governor's plan to create certified peer professionals. And along with that opportunity, I actually found out that some training I had prior allowed me to be grandfathered in. So it was really interesting that the work I used to do with youth actually was already peer work.
Oh,
so
terrific.
That's how I got there.
Okay. Now, what does the company do?
Peer Professionals of California, actually right now, we are really fortunate. We've been able to contract with Medi-Cal, and we provide ECM, Enhanced Care Management Services, to all populations of focus. I specialize in JI, which is the Justice Involved population, which allows me to utilize my relationships with the Justice Involved community in San Diego County. And I have a role as the consultant for Alternatives to Incarceration, the public safety group in San Diego County.
Terrific.
Yes, sir.
How does Peer Professionals of California work with CAP Alliance?
Well, I found that as I was learning about CAP Alliance, we had already performed some services through one of CAP Alliance's main entities, which is Five Keys. The DA's office actually asked me as a certified peer training and the chair for peers if I could assist this organization because they were working in the riverbeds. They were encountering individuals and they wanted to be trusted messengers. They wanted these individuals to have the skills to be able to communicate with individuals that were homeless, that were impacted by trauma or incarceration. And so what I did is I linked Five Keys to my peer training partner, and I opened up the avenue for internships, employment, and then if that wasn't needed, I just supported whatever Five Keys was doing in that work through my connections.
Well, that sounds pretty amazing. It sounds like you have quite a bit of background in this industry, which led to being grandfathered in, you said.
Yes.
What did you do before your current position?
I actually I have, and don't, what you would say, I don't hide it. I have a criminal history that spans over 15 years. I actually look at it from someone that has knowledge and training now, but I came from a very dysfunctional household. But even though I clearly understood that, once I was aware, I was accountable. So I actually took a job working with a company, a nonprofit called Metro, and I wanted to get in and get on the ground floor and start to understand how to case manage. And I already had some ideals because I've always been someone that wanted to design programs for individuals but design programs that work. I started with Metro. I worked there for 5 years, and right at the point of, I think, the first indication that Cal Ames was coming to life in 2020, I believe, I started learning about it, and I knew which way I wanted to go. I didn't envision having my own 501c3, but no one owns a nonprofit, but leading it and being peer-led and peer-ran and being supported by the aspect of that all my staff are trained the same way I am, They're all peers. They're all community health workers. They all have ACEs aware training to screen for trauma. You know, it just was, for me, I think to answer your question, I wanted to be what didn't exist when I got out.
Mm-hmm.
I wanted to be that. I wanted to be that door. I wanted to be that avenue. I wanted to be that guidance for others.
Okay, well, what a great answer. What advice would you give somebody that is a year or less from getting out of prison?
Reentry starts at the gate. Start preparing yourself the day you get there.
Needs and support network before release. Secure housing or transitional
Excuse me.
It's okay. Yeah. Just, I think that they should be preparing themselves the day they get there.
Mm-hmm.
They've already been convicted. Learning to fight your criminal case or appeals, all that's a part of it. But reentry starts at the gate.
Mm-hmm. Mm-hmm.
You know?
What are the biggest challenges that you're faced with right now as a professional in this industry?
Honestly, I would go out on a limb and say that I am so truly blessed, but then I think about trying to house a woman with 2 kids, or trying to house a senior that's been locked up for 50 years with only $800 income. So I can relish in my success, but it means nothing when people are still suffering.
Mm-hmm.
So that's my challenge, trying to figure out how to utilize my understanding of CalAIMS, benefits, Medicare, Medi-Cal, to protect our seniors. And then, you know, as a consultant, being able to try to figure out how I can get the county or counties to, our housing is set up by beds. Mother with 3 kids, her kids can't pay $800 for their bed. Our system is failing. Mm-hmm. You know, when we want to protect, I think we have to be removed from the haves and the have-nots, and we're not ready yet.
Mm-hmm. Mm-hmm. Well, thank you so much.
Yes, sir.
Really appreciate it. You're
Thank
doing
you.
some great work, and I look
trying.
forward to seeing you out there very soon.
Thank you, sir.
Before you cut it, what do you think it would take for us to be ready?
I think it starts with the constable. I think it starts with the constable, the jailers, the DAs, the public defenders. The constable has to be accountable. Everything that our society is dealing with stems from some form of trauma, some form of conditioning. And until we start rectifying those elements that are just parts of systems and removing them, we're going to always have this problem. I'm adamant that here we are in 2024, but we're such a young society, a young species, really. If it wasn't for technology, we'd still be primitive, because we act that way every day. You know, we don't take care of people. You know, we're America's greatest city, but with the largest homeless population, except for in third world countries. Our population is going to surpass them, because we have haves and have-nots. So I think it's an impossible question to answer, but I think it starts with the constables, the leaders, being accountable in all phases.
Thank you, Robert.
Thank you.